Hey, today we're here with Gloria. She's our patient today, and she's had a little bit of lumbar spinal stenosis, so we want to apply some mechanical traction today to get her started with that and to kind of help with that pain. So some indications for that is she's having a bit of muscle spasms right now, and so we know mechanical traction can help with that, and also just she's having that spinal stenosis, so we kind of want to alleviate the pain on her vertebral discs a little bit on her back and on her spine to kind of help with that maybe the pinching of the nerves back there. Some contraindications is we want to check if she's had any fixation surgeries or anything that could any fusions that could mess with that. We don't want to pull those apart, and also we want to check if she's had any fractures, any acute injuries, muscle strains, sprains that are acute and shouldn't be pulled on. So Gloria, today we want to do a little bit of that mechanical traction we talked about, and so we're going to go ahead and get you set up with that. Is that okay?
Yeah, sounds great.
Okay, perfect. Go ahead and, well, I guess I can leave it there for now. Okay, so what we're going to have you do is we'll have you take your shoes off real quick.
Okay.
And I just want you to lay feet facing that way. Okay, perfect. Okay, and then I'm going to go ahead and strap you in here. So I want to get this nice and kind of tight, but not too tight, so just let me know, but we don't want it slipping off. So how does that feel?
Feels good.
Nice and tight. Okay, get right there. So we want to get right below the ribs. Same thing, we're going to get nice and tight here. That feel all right?
Yeah.
Okay, perfect. And then go ahead. I'm going to strap this belt in. Make sure that is nice and tight. Okay, how's that feel, Gloria?
Feels good.
Perfect. Okay. So next we're going to take this, loop it in our belt here. To this, attach it. Okay, make sure that's pulling from the right angle. And we're doing it supine because she's been having trouble laying prone, and we want to get her in a comfortable position. We'd add wedges under here, under the feet. And then let me grab this so we can show the parameters. Yeah, well, I don't understand why it's not switching angles. Okay, so here's the parameters here we're gonna set. I don't know if you can see that. So we're gonna go traction idle. We wanna go to lumbar. We wanna do posterior. We wanna do progressive. Hold force. Gloria weighs 200 pounds here, so we want to do 50% of her weight. So we're going to start her off on 100 pounds here and see how she tolerates that for this first session. Okay, so then we want to go and we want to unlock the table. Okay, come down here and unlock the table right there. I don't know if you can see that, but okay, and then I'll have Quinn hold this for a second. Then first we want to give you this, I'm going to give you this safety button. So we're doing traction today to kind of relieve your pain a little bit, help with those muscle spasms. So if we start pulling on this and it starts to radiate your symptoms and really make it hurt more, we want to stop. So for any reason, if you feel it's hurting and we need to stop, you can go ahead and press that button and that will stop the machine, okay?
Okay.
So, okay, we're going to go ahead and get started. So it'll start to tug just a little bit. Just let me know if anything feels uncomfortable.
Okay.
Okay, and for this first little while, we want to stay with the patient until it gets up to the max hold force, just to make sure patient's comfortable, can tolerate it, and that we may not need to change any more parameters if something's going wrong. So go ahead and hold here for just a little bit. Okay. And then for the purpose of this video, we're going to pretend like it got all the way up there and that it's all done. So we're going to go ahead and hit stop and slowly let that go down. And once it's down, we want to leave the patient in this position for a little while so they don't just get up right away and undo what we just did. So we're gonna go ahead and undo Quinn here real quick. I mean, Gloria real quick. Does that feel all right, Gloria?
Yeah, felt great.
Okay, perfect. I'll go ahead and undo it here. We're gonna leave them there for a second.